Very good afternoon, everybody. I'm Sayukta from Bladder Wellness Team. I'm sure all of you must be keeping good health. OAB or overactive bladder is a frequent and sudden urge to urinate that may be difficult to control. The condition is common and distressing and may have a large impact on the quality of life. In this month of World Continence Week, let's unite to raise awareness about incontinence related issues and its impact on the life of people living with it. To throw more light on the subject and guide us on what's right for diagnosis and treatment of an overactive bladder, today we have with us renowned Dr. Meera Ragavan. Dr. Ragavan is Senior Consultant Obstetrician and Urogynecologist in Chennai. Dr. Ragavan is having 26 years of rich experience in the field of urology, urogynecology, and carries out the treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. Compassionate, comprehensive, and ethical service is her goal of you, ma'am. A very good afternoon to you. It's a welcome once again, Dr. Ragavan.
Thank you, Sayukta. Thank you.
Dr. Ragavan, as today we are going to talk about World Continence Week, the significance, and of course about overactive bladder. So first of all, I'd like to start with that, why was a need to celebrate World Continence Week? What is the significance of celebrating World Continence Week?
World Continence Week is usually observed in the third week of June, around about 20th to 26th. The reason for that is nearly 60 to 70% of the world population who are aging can suffer from continence issues. That is the major problem. And we now see from the boomer era, where there were younger people, now most of the continents have moved on into a scenario where there are people who are octogenarians, who are more than 70, 75. And many countries have that population as a significant proportion. And even if you take India, 20% are above this age group. So people's longevity is increasing. And the attendant problem with the increased survival are those of bladder weakness as well as incontinence, which is why the World Health Organization has observed this third week of June as a World Continence Week.
Right. I think it's important to not suffer in silence and spread awareness and tell them that please come up, talk about it. It's treatable. Doctor, as we are also going to talk about OAB and overactive bladder, and incontinence can be one of the symptoms. So we would like to know what an overactive bladder is.
Overactive bladder is actually an umbrella symptom of urgency, where the man or the woman feels an irresistible urge to go and use the washroom with attendant leakage of urine accidentally and increased frequency to visit the washroom. So it's a combination of all these three symptoms of urgency, frequency, and urge-associated leakage or discharge of urine. So this put together can be comprehensively called overactive bladder. However, it doesn't need to be all three symptoms to call it an overactive bladder, because we do have patients who do not have any leakage, but still go to the washroom when there's an urgent call. So it can be a dry OAB or a wet OAB.
Okay. And we would also like to know about the causes that are responsible for an overactive bladder.
Overactive bladder can be caused by a multitude of reasons. For example, if somebody is overweight or somebody has a habit of drinking caffeinated drinks in excess amount, like, the fizzy drinks or coffee or tea, and who do not have regular bladder habits like toilet training habits, who have been trained as a child to go very frequently or to postpone urination for the fear of catching infection by use of public toilets, people who are constipated, people who have uncontrolled diabetes, are taking medications for their blood pressure issues or heart problems. These are the kind of subset of patients who can develop overactive bladder in the long run. But women in general tend to develop overactive bladder more so than men because of the physiological changes they undergo during their lifetime due to the hormones and the various aspects of either coming of age during periods, getting periods as menarche, or during pregnancy, or the hormones related to pregnancy and delivery, and also due to menopause, are more at risk of developing overactive bladder.
Right. So there are n number of things that can, cause overactive bladder. Now, the thing is that, as you said, that obesity can be one reason, uncontrolled diabetes can be one reason. Your lifestyle habits like drinking too much of coffee or stuff like that can be one of the reasons. Can we say that by reducing these, or I can say that by doing some lifestyle modifications, a person who has these symptoms can actually curb them?
Of course, yes. See, lifestyle modifications tend to help at least 50 to 60% of the symptomatology, and majority of the patient can have a less severe form of OAB if we address the lifestyle issues in the first place, which is great news. Because if we reduce the weight of the patient or motivate them to lose weight and avoid coffee, tea in excess of more than 2 cups a day, prevent water intake after, say, 9 p.m. before they hit the bed, or avoid smoking or quit smoking completely, and control the diabetes stringently, we can make a huge difference to the symptomatology, the degree of bother, and the impact that OAB would otherwise have on the day to day routine.
Right. Doctor, as we always say, prevention is always better than cure. So I'm sure if we do all these as a preventive measure, then chances are there that we'll never have this issue.
Absolutely. Usually, what we have noticed is overactive bladder, if it suddenly comes, say, for example, a 55-year-old lady who has attained menopause 2 years suddenly develops this overactive bladder. The general pattern which we see is it stays on for 3 to 4 months and then resolves on its own if we have addressed those lifestyle triggers and if we have managed it conservatively or with medications, beyond which they tend to become better. It can resurface again if there is a trigger, usually a urinary tract infection or a worse episode of constipation or a bad episode where the control of diabetes has been lost. So it can resolve on its own, but majority of them would need some medication in some form, would need these lifestyle modifications to be addressed so they can get a better result.
You just mentioned UTI, urinary tract infection, which is quite common, especially in women. Now, you also mentioned that women are more prone to have OAB, an overactive bladder. Now, is or can UTI one of the reasons responsible for that? Because in women, UTI is very common.
Yeah, UTI is urinary tract infection. But unfortunately, when we mention this term overactive bladder, or say urgency, frequency, many people relate or assume that it's only due to infection and just take antibiotics. It will not become better if it's overactive bladder. An episode of urinary tract infection can trigger off overactive bladder. But all overactive bladder is not necessarily due to urinary tract infection. So, unnecessary superfluous treatment without dwelling more into the history from the patient or assessing the patient in totality with antibiotics will not get us anywhere with regards to treatment of overactive bladder. So, concentrating on what the patient is trying to tell us, making sure the lifestyle modifications are taken into account will help us move forward with the management of overactive bladder.
Fair enough. Doctor, another issue with women who are aging, it's common with everyone, that's the pelvic floor, and especially in women because after delivering baby, it is said that, your pelvic floor, you need to strengthen your pelvic floor. And many a times incontinence results due to that. I mean, is there any correlation? And if then, how can a woman at an early age, try and safeguard herself from having incontinence issues in future?
Yeah. Pelvic floor plays a very vital role in the causation as well as worsening of the incontinence. The reason why it happens, so the pelvic floor acts like a hammock underneath the bladder base and the urethra, which is the conduit from the bladder to the outside. So when this hammock becomes very weak or stretched or doesn't have the enough tone and strength, it tends to give way, especially when there is pressure from above, say on coughing, laughing, sneezing, and stuff like that. So the bladder leaks. That we call it a stress incontinence. Even otherwise, the pelvic floor tone determines how anybody is able to control urine when there is a sudden urgency spell. Even for overactive bladder, when they have an urgent contraction to pass urine, the pelvic floor, if it's very well toned and very well strengthened, when you contract the pelvic floor, we can make the urgency disappear and give the patient some time to go and reach the washroom, make herself or himself ready to relieve themselves of urine. This can be effected very well by pelvic floor strengthening by scheduled exercises, which are to be done on a regular basis under supervision. So I just tell a patient, just go and do your pelvic floor exercises. It's not something they would understand because not everybody is aware of their body. Not everybody is aware of the muscles, what we are calling as pelvic floor muscles. And they do not know which muscle to exercise and what to do for the exercise. So it's no point giving a prescription or saying to the patient, go and do your pelvic floor exercises. It's hard to comprehend and understand. So they need direction as whom to go, when to do, how long to do, and how effectively they should be doing.
Yes, you have very rightly said that there is a procedure and way of doing everything, and that the same goes with pelvic floor exercises. Doctor, a question related to it, what just occurred in my mind is that these days Kegel exercises, I'm sure Kegel exercises are the exercises that
Yeah.
we do to strengthen our pelvic floor. Now a lot of because people are more into social media these days, a lot of videos etc goes viral of those Kegel exercises, but you said that there is a process, there is a way, exact way to do it. How safe it is for people to just go through a video on a social media, you don't even know that who is doing it. I mean, how authentic or genuine way is actually or she is trying to, teach you. How safe it is to just see and start doing it.
Say, for example, I'm doing strength training for any of my biceps, triceps.
Mhm.
I would prefer to have a trainer or hit the gym where I can get instructions properly for two reasons. I need to know whether I'm doing it correctly and I need to prevent injury. So unknowingly, if somebody, I watch a video or see a picture and start doing biceps, triceps training with unlimited weight on the first day without knowing the technique, I'm more likely to injure myself and not do it forever rather than do it in the proper way. So these are the situations or limitations on one following just the social media video link or a picture or a booklet and trying to do. It might be okay for somebody who is doing it as a preventive measure. Say Kegel's exercises or pelvic floor exercises are mandatory for every woman out there, especially after their first delivery, and they should be doing it lifelong to prevent any future possibility of occurrence of incontinence. So in a preventative manner, if you're looking at a video and starting to do your pelvic floor exercise, it's well and good. But if I've done a prescription of pelvic floor exercises for somebody, or you're getting treated for incontinence, and this is one of the methods of treatment, obviously a video link or a pamphlet or a leaflet is no good. It's as good as just writing it in prescription. So it's better to have a supervised training from a proper physiotherapist who's interested in pelvic floor and understanding whether it's the correct amount and tone which you're exhibiting during the training.
Right, completely understand. I agree with your point. Doctor, now patients who are having these symptoms, at least our viewers who are, going through this session, at least by now they know that these are the symptoms, and maybe they are going through these symptoms and not coming out and telling others that, see, this is the issue I'm facing. What should they do now?
They are not coming out with the symptoms.
uh, they are not talking about it. They are just suffering in silence, and they just need guidance, that now at least they know that it's an issue. You just can't associate these symptoms by saying I'm aging, so I'm bound to
No.
have these symptoms, or I'm diabetic. What should they do?
Yeah, very good question. So you do not ignore these symptoms as just part of aging or something which is inevitable. No, if you have urgent visits to the washroom, you leak while you before you even reach the washroom, frequently visiting, getting up multiple times at night, you have bedwetting issues, repeated urinary tract infections, please see a urogynecologist if you're a woman, or a urologist if you're a man. Do not ignore the symptoms if they tend to persist beyond 2 weeks, because it's not urinary tract infection. These are the two specialties you need to visit and get appropriate assessment as well as treatment instituted. So it's important for you to take the advice on board and start working on it.
And Dr. Now we would also like to know about the treatment options that's available for an OAB.
Yeah. Now, overactive bladder, as I mentioned, is a very good condition which lends itself beautifully to medical management. And we have already discussed the lifestyle modifications like weight reduction, control of their diabetes, making sure the medicines they take for other conditions are on the right dosage, and regularly practicing washroom visits according to the time rather than by your own will and wish, because that helps to exercise the bladder muscle better. Avoid excess alcohol and coffee consumption, avoid fizzy drinks, and do not drink water beyond 9 p.m. before bed. So these are some of, and quit smoking. The smoking is an irritant to the bladder and can make the bladder overactive and not respond to treatment very well. Now, with regards to the medicines, there are two types of medicines which are fantastically effective as far as overactive bladder is concerned. The overactive bladder basically is a storage disorder. The bladder is supposed to be like a vessel which is elastic and tries to store as much as urine and then let it out when it is deemed appropriate. Now, when there is an issue with storage, that is when you get overactive bladder. So there are medications which make the muscle a bit more quieter and avoid the contraction, what we call anticholinergics. That will help quieten the bladder muscle, prevent that urgent contraction and the urge associated leak as far as overactive bladder is concerned. The second type of medication reduces the or increases the resting tone of the bladder and makes it more compliant and helps it to store better. Those are called the sympathomimetic medications. The first one has a bit of side effects in the form of dry mouth or constipation and cannot be taken of your own will and accord, because they can have interactions with other medications which elderly people are normally taking. And it has one serious effect in the form of glaucoma, which can then cause loss of vision as well. So my message out here is, yes, you can be helped with medications for overactive bladder, but they are not to be taken without a proper prescription, dosing, and schedule, and you have to be under monitoring for the side effects for these medications. The other important message I want to give out here, your prescription is for you. You cannot share the prescription with somebody else who's your family friend or kith or kin who have been suffering from the same problem, because your medication might not be suiting or might not be effective for the other person.
I completely second that. We all are different. Our causes may differ. So what may have worked for me will not work for you. So because we all, we have this tendency of going to the chemist and asking, see, I have these symptoms,
Yeah.
please, kuch de do. Or we just will ask our friend and he'll say, oh, I went through the same thing and these are the medicines I had. So please have it and you'll be cured. Don't play with your life is what we are trying to say, is what
It's
the
not
doctor
like
is saying.
potluck where you share your goodies and foodies with the neighbors. Medications are not supposed to be done that way.
Right. So please go and visit your doctor in case you have these symptoms and do not ignore the symptoms. Doctor, one more thing. If a person is continuously ignoring, I mean, definitely no one can ignore the symptoms. Definitely, if they have the urge, etc., they'll go and to the washroom a number of times. But if they are not going for the treatment part, they are not going and showing up to the doctor, how serious can an untreated OAB become?
Okay, that's a very valid and important question. First of all, the threat or the danger is what they think could be overactive bladder could be a manifestation of bladder TB or could be a manifestation of a carcinoma inside the bladder, especially for smokers. So you cannot ignore the lower urinary tract symptoms of constant visits to the washroom. You have to go even when the bladder is half full. It's a constant irritation and urgency. These are symptoms which should not be ignored if they're persisting beyond 2 weeks because we do not know what is causing the overactive bladder in the first place. To assume it is overactive bladder, we need to do certain tests and rule out sinister conditions which could precipitate an overactive bladder like picture. Say, for example, a simple urine analysis will tell me if there are pus cells in the urine, if there are blood in urine, if there is an infection, and the culture will give me the type of bacteria, may help me find out whether there is any TB bacteria in the urine. So I will be able to do that only if the patient approaches and I do certain tests and I do certain assessments. So overactive bladder, before making the diagnosis that it is plain overactive bladder, we need to rule out dangerous causes which can precipitate an overactive bladder like picture, and therefore the need for patients who suffer these symptoms to visit your specialist to get a complete assessment is important. The second very valid question, if you leave it untreated, what can happen? Your bladder then loses its capacity to work like a storage organ. So it keeps on contracting, it loses its elasticity, it becomes a small contracted bladder. And what normally can hold 400 to 500 ml of urine will now be converted to a small capacity bladder of 100 ml. So imagine 100 ml urine, you will be visiting the washroom every 45 minutes. That will make your life miserable. You will be constantly occupied wherever you go to do what is called toilet mapping. That can be an enormous strain on your psyche, your mental health, as well as your physical health. And people like these tend to socially exclude themselves from many gatherings or family visits or friendly occasions, and they become very, very depressed and isolated.
Yes, I know many women who are so frightened to go out or travel because they are continuously, thinking, where will I go? How will I release myself? Where will I find a loo? What if the loo is not clean? And that, as you very well said, they are actually going through a lot of discomfort, depression, etc. So it's better to please open up, talk to the doctor, go and
Yes.
visit a doctor. Don't just suffer in silence, is
And
what
many
we are
people
trying to say.
don't even know that this is a problem. These awareness program, and I'm very glad we are all doing it, that this help people out there when we discuss these things for them to have a spark in their mind saying, oh my God, I have been suffering with these symptoms for quite some time, but I have not spoken to anybody. I didn't even know that this was a problem and there is a remedy to it. So let me now talk about it. So I'm glad we are doing, and it's very important as our duty as healthcare professionals to create awareness. We shouldn't be doing this awareness program now, but yes, something is better than nothing. we should have moved on from here with regards to treatment for the same.
Yes. One more thing, doctor, because with the whole urinary system, there are two, three organs that are associated, like kidney is there, which works as a filter. We have, and men, prostate is there because the whole path goes through the prostate. Of course, bladder is there. Now, if a person is suffering from OAB, are there any chances that the other associated organs will also get affected?
They can get affected. Say, for example, if there is TB, which is causing the overactive bladder, or it's a neurological problem which has resulted in an overactive bladder, like post-stroke patients, spinal injury patients, or Parkinson's patients who have developed this, they can develop kidney back pressure and failure of kidneys as well. So it's not something to be ignored when, especially that is why we do the full assessment, we do the blood test, we do the urine test, we do an imaging of the kidneys to make sure they are fine and there's no back pressure in the kidneys. So the kidney can take the brunt of a problem which is actually causing the overactive bladder and become hydronephrotic or swollen up and then develop failure. So that is very, very important for us to realize. Now, as far as men are concerned, prostate, when it enlarges in midlife, can be due to benign causes, but certain proportion of them could be due to carcinoma prostate. How will we find out? Unless these men do not assume that it is normal part of life and aging, they go and seek a urologist assessment, they will never be able to find out a carcinoma prostate. Again, as a message to men out there, if there is a family history of carcinoma prostate, you need prostate screening every year in the form of PSA. It's a simple blood test which helps you detect the prostate-specific antigen protein, and if it's high, that needs immediate attending to. So it's a simple blood test which is part of the annual health checkup for men above the age of 50. And if you have family history of prostate cancer, you should start screening from the age of 40.
Right. So men, women, please don't ignore your symptoms. Go and seek help from a doctor and trust your doctor. That's really important. Questions are pouring from viewers. I'll pick one by one. Okay, so two questions by different viewers and their questions are on the same line. Plus, we have already discussed it, but maybe they have joined a little later. So I'll pick the questions. Radhakrishnan is asking, are there other lifestyle steps to take in order to manage OAB? And Albi Raja is asking, are there dietary habits which help in preventing OAB?
Too much of salt intake, too much of sugary substances intake. People have a habit of drinking juices or, squashes and things like that, being summer and stuff. They are osmotic in nature and they make you pee a lot, but don't necessarily hydrate you. These lifestyle steps have to be taken in order to manage overactive bladder. Your fluid management is very, very important. Avoiding constipation at any cost helps a long way to avoid as well as treat overactive bladder. This is a problem, especially in elderly or bedbound people or not so active elderly people at home. The general complaint above 65 is constipation. More the constipation, more the urgency, more the leakage, more the frequency. And that has to be avoided because then we will not be able to 100% treat the overactive bladder. So these are some of the dietary advices. So include high fiber in your diet. Make sure you take plenty of fruits and vegetables rather than fruit juices. Adequate hydration, avoid fizzy drinks, and avoid constipation.
Right. Doctor, one more thing. People have this notion that drinking a lot of water is what will keep them healthy. Now, when they say a lot, they don't have a limit to that. I mean, it's not about adequate water. It's a lot. It can go from 6 to 7 to 8 liters a day. What's the trick?
You do not need that much water because the urine production in a day is only 1.5 liters. So allowing for summer or allowing for sweating, you need probably a 500 or 750 ml extra. So an average person who weighs 20 kilos needs 1 liter water. So it is weight dependent and how much strenuous activity you're doing on a regular basis. So not more than 3 to 3.5 liters. We would restrict that water intake to 2.5 or less than 2 liters for somebody affected by overactive bladder.
Okay, okay. We have Ankur Prasad with us asking if someone is leaking urine during laughing or sneezing, can this a symptom of OAB?
It is not usually a symptom of OAB. It is usually what is called stress incontinence, where the bladder is actually a quiet observer. It doesn't contract at that time. It's the sheer pressure on the bladder which makes the leakage happen. So this is a matter of pelvic floor problem where the pelvic floor is lax and is not able to hold on. So pelvic floor exercises, if at all, will help this person better than the overactive bladder.
Right. We have Kishore Mishra asking, are COVID patients more vulnerable to OAB?
Actually, yes. Unfortunately, post-COVID pandemic, I have seen a big surge in women coming to me with the recurrent urinary tract infection or worsening of overactive bladder or a new onset of overactive bladder. I doubt it could be due to the reduced mobility which they have had after COVID, prolonged cough or chest symptoms, weight gain due to the steroids, aberrations in their diabetic management, or diabetic control being out of order due to the various medications and due to the COVID itself, and other complications which have risen after the COVID. Yes, urinary problems have gone on a big surge following the COVID pandemic. So the answer is yes to that question.
Okay. Shalini Mehra is asking, if my bladder is removed, what are my options for passing urine? What are the pros and cons of each?
That's like an extreme which people will do what we call cystectomy. Cystectomy means removal of the bladder for patients who suffer from cancer of the bladder. So they will need to have either the tubes which come conduit the urine from the kidney, what we call the ureters, which were originally coming into the bladder, to be going into what is called a neobladder, which is a new bladder which we create out of the intestines, or directly into a piece of intestine or a tube of intestine, after which it is brought out to the outside and you have a bag, what we call a urostomy bag or a colostomy bag, something like that. So urine will be collecting in the bag through a conduit of intestine. So you will not be able to pee in the natural way. From that point of view, it will be collecting out in the exterior. That's a drastic step which is reserved for patients who suffer from cancer of the bladder.
All right. Yes, Sharma is asking a very technical question. What are the different species of bacteria that can cause UTI? And does the severity of UTI depends on the species of bacteria that infect the patient?
Yeah, it does. Because the commonest reason why the commonest bacteria or bug which are found in the UTI specimens of urine are what we call E. coli and Klebsiella. These are the two main types of bacteria, or sometimes we find Enterococcus. These are the three types of bacteria which commonly encountered in a UTI because they are the main bugs which are present in our bowel. When these bacteria overgrow, either due to a previous episode of broad spectrum antibiotic usage or a worsened episode of constipation or diarrhea, or some immunocompromising situation like steroid intake, COVID, for example, some transplant patients, these bacteria then overgrow, and that is when you develop E. coli UTI or a Klebsiella UTI. Patients know nowadays, they come and ask me, I have E. coli in my urine, what should I do? That's because these bacteria are normally present. UTI does not come from outside. So this myth is like, I'm going to use a public toilet. Am I at risk of developing UTI? No. It's about the cleanliness rather than that being a source of infection. That's all. So the source of infection is in our own body. It just overgrows when there are certain reasons why it would overgrow.
Right. Doctor, I would also like to know about what are the common mistakes that patients with OAB, normally commit, which may actually worsen their condition or actually will, lengthen the time or duration of the treatment? Are there common mistakes?
Yes, yes. Many patients repeatedly take antibiotics. This is not going to make you better. This is going to change the bowel flora. It will make you develop UTI with resistant bugs. So it's a double-edged sword. It will not make you better in the first place, but also predispose you to very dangerous form of urinary tract infections. So unnecessary antibiotics, prolonged courses of antibiotics, repeated course of antibiotics are a dangerous proposition in patients who do not get the correct treatment for overactive bladder. There is a possibility that the overactive bladder can worsen, and you can move from a step where only medications or lifestyle modifications would have otherwise helped. But then you're transiting into a position where I might need to put something like a botulinum toxin or a Botox inside the bladder to get you better, or something like even a surgical procedure. So leaving overactive bladder untreated or not properly treated for a long time could mean that you're moving from a milder variety into somebody needing intervention or even surgical intervention.
Okay. And Doctor, as now we are moving towards the conclusion part of this session, anything that we missed on or any message, takeaway message for our viewers?
Sure. There is one particular condition called bladder pain syndrome, which also mimics overactive bladder. The one thing which differentiates a bladder pain syndrome from overactive bladder is the pain component. Overactive bladder patients do not suffer from pain, whereas the bladder pain syndrome, usually women suffer from constant pain in the pelvic area, in the bladder area, especially when the bladder is filling. And they feel a bit of relief when they empty the bladder. They go frequently to the washroom, and they are associated with an urgency which precipitates the pain when the bladder fills up. These are usually middle-aged women who unfortunately get treated either for UTI or overactive bladder, but never get better because the quality of life is significantly compromised. This is one condition you need to pick up early to make a difference to the prognosis of the patient and also to treat the patient effectively. If missed, these bladders are notorious for becoming scarred, ulcerated, and contracted, and can become a lifelong problem for these patients to empty the bladder effectively and can be extremely painful.
Right. And at the end, just to summarize the whole thing, the important points that you would like to repeat for our viewers.
Yeah. So overactive bladder is a condition which can be easily treated and completely resolved. There is no need for anyone to suffer in silence with, if at all, you have the symptoms of urgency, frequency, or going frequently in the night and leakage associated with it. So make sure you have weight reduction as your first point if you're obese. Make sure you control your diabetes very well. Quit smoking once and for all. Avoid excess caffeinated drinks on your daily diet performer. Reduce sugary substances on your everyday diet and practice healthy toilet habits of going to the washroom on regular intervals and not postponing the visits to the washroom. If we concentrate on these lifestyle measures and if any of these symptoms of frequency, urgency, or pain and leakage persist for more than 2 weeks, please visit your specialist, a urologist in case of a male and a urogynecologist in case of a female, to get appropriate help and direction as how to manage the situation. So that is the message I would like to give all viewers out there during the observation of World Continence Week.
Thank you so very much. Thank you so very much, Dr. Meera Ragavan. It was wonderful talking with you. It was wonderful to have you with us. And thank you for your valuable time. And it has been quite an informative session for our viewers. We really look forward for many more such sessions in coming times. Thank you.
Sure. Thank you.
And thank you, viewers, for an excellent participation and for more information on how to diagnose, manage, and treat overactive bladder. Stay connected on our every page, Bladder Wellness. We are also available on YouTube, Twitter, and Insta. Thank you. Goodbye.